Hi, everybody. There's a lot of pregnant women out there with concerns about COVID-19. So let's discuss that real quick. It's a novel virus, so we don't have a lot of data. The limited data we have are case studies from Wuhan, China. And if you look at the world literature today, March 21st, 2020, we're talking about only a grand total of 36 babies and 35 pregnant patients. And we do have data from other coronaviruses like SARS and MERS and influenza. So let's take this data. Let's talk about vertical transmission. In a Lancet paper, it appears that there is no vertical transmission. The amniotic fluid, the breast milk, the cord blood, and the neonatal swabs all tested negative for COVID-19. All but 3 of the babies in that paper were delivered by C-section. So we're not 100% certain if there's risk of vertical transmission with delivery down the birth canal. If you look at the pregnant patients themselves, the evidence seems to suggest that there's no more severe disease and no evidence of more risk in pregnant patients over the general population. The infection control methods are the same: social distancing, remember 6 feet, and avoiding large crowds. And the decision around delivery is made around the usual obstetric concerns and indications in collaboration with the specialists. Let's talk about the fetus. It does seem that there is increased distress and preterm labor, but the outcomes for most neonates were actually very good. And it seems like a lot of the bad outcomes were due to the medical interventions themselves because of concern about the mother's condition. So at this time, we don't know if there's an increased risk of miscarriage from COVID-19. The American College of Gynecology recommends a 14-day separation postpartum between mom and baby. That's hard to do. Other groups have other recommendations. But either way, you have to watch the baby closely for respiratory distress. There are some groups that are actually recommending against in vitro fertilization and assisted reproduction techniques because of the unknown effects of the virus in early pregnancy, and also because of the unknown availability of healthcare resources in the future. I suspect that there will be more COVID-19 babies in the future because we're all in isolation with nothing better to do. So maybe you can name that baby Corona. Stay healthy.